Well, hello, everybody, and welcome to Alive with Amanda. And today's topic is going to be on progress notes and how long should they take you to complete. This is something, again, that comes up all the time. I see it. People want to know, like, how do I complete my notes quicker? And how do I get stuff done so that I'm not wasting a lot of time? There's all these memes going around about notes and how long they take and how many we have and how to get them done between sessions and, the rush to do notes. And notes are sort of like an annoying part, but a necessary part of being a therapist, whether you're at an agency or you're in private practice, but especially even if you're in private practice, because there's still liability that's going to come up when you're in private practice. So you're going to want to make sure that, yes, that you have your notes done, they're done in a timely manner, and that they have all the required information that is necessary. So then that way, if you ever get audited or if you ever have an issue, see, a lot of the times people that are private pay and don't take insurance are like, I don't need to write in-depth notes, or I don't need to include a lot of information in my notes. And I think that's a mistake. I don't think that we need to write novels. I know that some people write a lot, way too much in their notes, and that can leave you open to liability. But I think it's really important that you keep adequate notes for what's going on, especially if you have high-risk clients. So if there's clients that have specific diagnoses, are on more of the pervasive mental illness spectrum, or any kind of suicidal ideation, or even medication, right? Those can be kind of like high-risk types of clients. And so you want to make sure that you're writing adequate notes and that you're keeping all of the information that's necessary, but that you're not doing overkill. I have seen sort of that the standard for a note is about 2 minutes. And so if you're doing notes in any longer amount of time, you may want to look into whether you're overthinking the notes, if you're worried about liability too much, if you're adding too much information, right? Again, your notes can be subpoenaed whether you are at an agency, if you have a practice that takes insurance, or you don't take insurance. Those notes can be subpoenaed, so you don't want to put too much information in there that is going to open you up to any kind of liability. But you don't want to just put patient reported, doing well, in session, we processed emotions, the end. I want to give a shout out to our sponsor, TherapyNotes. One of the great things about TherapyNotes is that they have notes in there that are for initial assessments and follow-up appointments. So then that way you can have all of the information that an insurance company is pretty much going to require. The diagnosis, the time, the presenting problem, a mental status exam, what the client reported, what interventions you used in session, the follow-up treatments. And so I think that's a wonderful thing that TherapyNotes offers. So if you're looking for an electronic health record, I would definitely check them out, because they have made note writing for our practice very simple, because I know that everything that's required by an insurance company, for instance, we have a practice that takes insurance, that it's all going to be there. But even if you're private pay, it's a really great, because you need to make sure that you are writing about the client's medications, whether they're compliant, if you've had any follow-up with their primary care or their psychiatrist where they're getting the medications from. I like to look back at my notes and read them. I don't do it often. I don't recommend you do it often. You don't need to do this all the time. But when I do go back and read my notes, I can see a story developing, right? Our clients come in every week and they tell us about their lives. They tell us the intimate details. And you might not include those intimate details in your notes, but if you go back and read through your notes, can you see a story developing? Can you see how the treatment has flowed? Can you see how they have made progress or haven't made progress? Can you see like sort of the ups and downs? Can you see how, if they've stopped taking their medication, how that has impacted their mental health? Has it exacerbated the symptoms? Can you see the symptoms that are doing better? Can you see the treatment flow that you've done? Whether you've taught CBT skills or DBT skills, is that identified there? And as you go back through your notes, can you see all of this? A really great way to see this is by doing a case consultation and reading back through the notes and seeing what you've done with the clients and see maybe where some of the holes are in your notes, or even holes are in your treatment. Maybe your notes are solid. You're doing them in 2 minutes. You're getting all the information out there that's needed, but maybe there are some places that you haven't looked, like the client, we haven't really done a lot of family of origin work, or we haven't looked into whether medication is something that they need, though they've reported, sleep and appetite disturbance for 3 weeks or 4 weeks. And so I would say, take a look at how long it's taking you to do your note. And, as somebody who works with people that are anxious, we as therapists have our own anxieties about note writing because of the liability. So doing your best to work through any overthinking that's happening, doing some thought stopping around that, and maybe putting yourself on a timer and say, I'm going to complete this note in 2 minutes. Or if you want to do 5 minutes, it doesn't have to be any particular way. We have fluidity. It's not black and white. But if you're taking 10, 15 minutes to do one note, it's going to be hard for you to really probably stay on top of your notes, or you might have to give yourself a lot of breaks, which is okay, but maybe you want to see more clients and you want to make more money. And one way that we can see more clients and make more money is by cutting down on that note-taking time. So thanks again for being on my live today. And please feel free to comment about how long it's taking you to do your notes. And I will maybe give you some other suggestions in the comments. Thanks, everybody.